Once again today, everybody that's on Medicare received an email from your federal government from the Medicare program saying, it's the annual election period and you need to choose your Medicare Advantage plan. Hi, I'm 𝗲𝗓, and what other people are not telling you is there are two ways to go on Medicare. However, for some reason, all the major corporations and now your federal government that you've paid your Medicare taxes into for your entire working life are all trying to shove you into a private Medicare replacement plan called Medicare Advantage. Is it a good thing? Is it a bad thing? Well, it depends on what your needs are, but I can tell you one thing. It is one general concerted effort to get you off of the original Medicare where you can go to any doctor, any hospital, without a referral, without prior authorization, and get the health care that you need and that you deserve, that you paid for your entire adult life. But they want you to give that up and get you into a private plan that the corporations benefit from. Just look at the email that you got today from Medicare. Does it mention anything at all about keeping original Medicare and using a Medigap plan, a Medicare supplement, to plug the holes of original Medicare and let you continue to go to anybody that you want to with no restrictions whatsoever? No, absolutely no mention of that whatsoever. Take you right into a plan to shove you into a private program. That's why somebody out there needs to tell you there's an alternative. I'm bringing to you today another investigative story about what happens in the world of Medicare Advantage. I've been teasing this for a couple of weeks and telling you that there's a very widely known, if you're an agent with any experience in this industry, thing that happens with Medicare Advantage with regard to skilled nursing care. Let's say you need care beyond the hospital, where you can recover in a skilled nursing facility for weeks or months after a treatment for something. And that's the biggest gaping hole with Medicare Advantage. We talked about the other ones with regard to cancer treatment, out-of-network care. Those are huge, but nothing compares to the skilled nursing care that you don't get automatically in Medicare Advantage. Listen to this story. It's incredible.
I was still trying to absorb who this person was in this rehab center bed. This man with a doctorate in physics who could no longer tell time. And here is this woman telling me they're going to end his coverage in 2 weeks.
How would you like it if artificial intelligence, that is a robot, kicked you out of the hospital and you're sitting there agonizing in pain? Or sometimes worse, your mother or grandmother or sister or brother gets kicked out of a facility because a computer said, you should be better by now.
This is Gloria Bent, married to Gary Bent for 56 years. After emergency brain surgery, Gary's doctors had a recovery plan. The plan never happened. This is about why. This is a story about good intentions, predatory corporations, and an unaccountable bureaucracy. This is a story about Medicare Advantage.
It is neither Medicare nor is it an advantage. It is, I think, will be recognized in years to come as probably the biggest heist, the biggest fraud, the biggest transfer of wealth from taxpayers, middle income, low income Americans, from them to corporate executives.
He was an incredible dad. He was so many things to so many people. On Memorial Day of 2022, he woke up and he couldn't remember how to do things like tie his shoes or make eggs. They discovered that melanoma had returned.
He had a surgery to remove the lesion and to take care of the blood clot that had developed in his brain. He was not the person I knew when he came out of surgery. The physical therapist who was seeing him post-op, as well as his neurosurgeon, recommended that he go to a highly skilled rehab facility. We felt fortunate that one of the best, well, the best in the state of Connecticut had a bed for him and agreed to take him.
His transfer to a specialty rehab hospital was denied.
I just couldn't understand why my dad's neurosurgeon says he needs this care. The specialty hospital says we have a bed for him and we think we can help him, but somewhere along the lines, insurance just steps in and says, no, we don't think this is necessary.
Gary Bent did not have traditional Medicare. He didn't have a choice. He was an educator, a Connecticut state retiree. Budget cuts pushed all state retirees from Medicare to private Medicare Advantage plans.
Skilled nursing facility coverage is almost always covered in traditional Medicare.
Christine's job is to help Wisconsin seniors navigate the various federal benefits they're entitled to. She deals with Medicare and Advantage issues every day. There are a lot of differences between Medicare and Medicare Advantage. We won't go into them all, but the relevant ones for Gary's story are managed care and prior authorization. Advantage is what the health insurance industry calls managed care. Medicare doesn't pay for services. Instead, it pays a flat fee per patient. With no financial incentive to push medical procedures, providers can take a more holistic and cheaper approach towards health. That's the idea, but it falls apart in practice with private insurance companies as a result of a process called prior authorization. Here, doctors need insurance companies' approval before they prescribe care. The industry says it's a way to cut down on unnecessary medical expenses. This doesn't really exist in traditional Medicare, but it does with Advantage. Insurers can use prior authorization to set treatment plans and override a patient's doctor. Despite the doctor's recommendations, Gary was transferred to a short-term rehab facility.
The team there were all going to assess him and then come up with a care plan. And before that could even be finished, my mom received a call from an organization that we had never heard of called 𝗪𝗵𝘀, telling us that my dad's projected discharge date was going to be in 2 weeks.
I pointed out that he was still being evaluated by the 𝗂𝗵𝗂 staff, and that in my initial conversation, I had been told to expect him to be there at least 2 months.
Think about that. The denial came before Gary was even evaluated by his care team.
And the 𝗪𝗵𝘀 representative's reaction was to laugh and say, oh, those physical therapists think they can cure everybody.
𝗪𝗵𝘀 is a post-acute healthcare service provider. They have an algorithm that uses a huge patient database to calculate probable outcomes. These outcomes are supposed to inform doctors' decisions. There's nothing inherently wrong with that. But investigations have found that this data is less about informing a doctor's decision and more about denying care. In practice, Advantage plans have outsourced the pre-authorization and care decisions to companies like 𝗪𝗵𝘀, who are using an algorithm to overrule treatment plans physicians prescribe for their patients. Individual circumstances don't really matter. The algorithm does. Gary's care team told them what to expect in the next few weeks. 𝗪𝗵𝘀 would deny care without notice. They'd have 24 hours to file an appeal. Then, another outside group called the Quality Improvement Organization would review the appeal.
They told me I would probably win 1 or 2, maybe even 3, but then the speed with which these denials came would increase. They would be fewer and fewer days apart, and eventually I was going to lose.
And that's what happened. Gary was denied care 3 times. His family filed 3 appeals. They won 2. There was no real rationale explained for any of the decisions. He had an option to appeal to an administrative judge. That meant more paperwork and a new level of financial risk.
It's then up to the patient to go back to all their therapists and say, can I have a documentation of every single treatment encounter that we had? It is hundreds of pages of records. About 1,300 pages was my biggest one yet.
Since the insurer denied the coverage, the family was now responsible for paying for everything out of pocket. They'd be reimbursed if they won, but that could be months, years down the line. And remember, unless they have family, patients have to navigate this process themselves. In Gary Bent's case, it would have been weeks after brain surgery. But if they're able to appeal, at the administrative judge level, the patient wins 75% of the time. That means that in 3 out of 4 cases, the care denials, 24-hour appeals, fighting an algorithm, gathering thousands of pages of documents, it should have never happened. The patients needed the care. And with these skilled care cases, basically none of them would have happened with traditional Medicare. One of the big issues is we don't know the scope of the problem. We know 75% of denials are overturned, but so many people never appeal. They rightfully give up. They don't want to fight a faceless bureaucracy set up against them, especially when it's in the last months of their loved ones' lives.
We felt like this process was designed to wear us out, and I would say it did wear us out.
We also don't know how much money insurers make off these Advantage denials. But the way the system works, there's a financial incentive for health insurers to deny care. The government pays Medicare Advantage providers a set amount per patient each year. Insurers get to keep a chunk of that savings if they spent less on the care than the government paid. Compared to regular insurance, Advantaged patients bring in double the gross profit margin. This is privatization in action.
The EMT who brought him home said that my dad felt like he had a low-grade fever, and I remember staying up through the night to monitor him. But in the very early morning, he was not responsive. He didn't know who we were. He didn't know where he was. And we called 911. What we've learned later was bacterial meningitis. He wasn't even home for 24 hours, maybe like 10 hours.
Gary went back to the hospital.
He was in the hospital for 3 weeks, and he lost all the progress he had made.
Eventually, Gary was released and went home. In spring of 2023, Gary Bent passed away, surrounded by his family.
This whole experience, it really opened my eyes, and I just can't understand how when someone is, in the sunset of their life, that they're having to go through all of this extra burden and hurdles that are unnecessary.
There was enormous stress in just having to fight for what he needed at the same time that we were watching his health fail drastically.
Medicare is a social system that was set up to actually provide care for folks. And Medicare Advantage, my understanding of it is that they work to deny your care to make profit. And one thing that has made a lasting impression on me is they're making these decisions and bringing money in hand over fist, and they robbed our family of things that you cannot put a price on. I would say don't sign up for it. It will not be there when you need it.
This is sick, it's disgusting, it's twisted, and this is the profit of Medicare Advantage. And again, if you can't afford a Medicare supplement, I just want you to know that there is another option there. You could do Plan N, which is way more affordable, which has lower rate increases year after year. That's why Plan N goes to most of our people when we explain to them what's happening, because we track this from California to Virginia and everywhere in between. We help people with Medicare all across the country. So you've got this choice, right? You've got original Medicare that you paid for with all the bells and whistles that it has, which means no prior authorization, no network restrictions. Nobody can tell you no if it's medically necessary. Now, I did have a lady write an email into my office the other day, and she said, I want to go to this doctor, and I call them voodoo doctors. They're just naturopath, whatever. And she wants this and this and this and this paid for by Medicare. Sorry, it's not medically necessary, so it's not approved by Medicare. So it doesn't pay for absolutely everything. It has to be medically necessary. It also doesn't cover dental, vision, hearing. That's why we have a dental, vision, hearing plan that supplements original Medicare, so you can go anywhere for that. But to think that you're getting a Medicare Advantage plan because of all the bells and whistles with watered down, fake, clean only, often dental plan or an eyewear plan if you go to certain network providers, oh, big deal. You can keep your toothpaste. I'd rather have access to Johns Hopkins, MD Anderson, the Mayo Clinic, Cancer Treatment Centers of America. All the places that have the best possible care are not typically going to be found in managed care. That's just the reality, and that's just the way it is. So the choice is yours. When you're brand new to Medicare, you can make this choice without any health questions, no resistance whatsoever. The choice is yours. After that, if you want to get on a Medicare supplement plan, we might have to ask you some health questions. Did I turn off the microphone? No. It depends on what state you're in. But again, we have experts in every state in my office, and our service doesn't cost you a dime, cost you nothing. Here are some of our websites that can possibly help you. How to start Medicare. Where to go file it? I don't know. planinmedicare.com or .org. Go there and learn about Medicare Supplement Plan N. Those people who are selling Medicare supplements and offering them as an option are typically not telling you about Medicare Supplement Plan N. Why? I'll give you a clue. It pays less commission. It pays less commission for Medicare Supplement Plan N because, little secret for you, insurance agents are paid by the insurance company based on the premium that you paid. So if you pay a lower premium, they get a lower commission. So when they're out there saying, Plan G, Plan G, Plan G, Plan G, that's the best thing in the world, then I just gave myself, if that's me, a 20% raise over telling somebody about Plan N and taking the time to explain it and first listen to see if it may or may not be appropriate. So you have to educate yourself, and that's what I'm doing here on this channel. So I encourage you to subscribe and share this with anybody you know that's on Medicare, because you can change plans. However, if you don't know that there's an option out there, then you're just stuck with what you already know. And that's why I'm doing this as a free service. So you can call in, we can help you. Our 800 number is not even on the screen. Or you can go to the website, or you can click this with your phone. You just hold your phone up to it and take a picture of it, and it'll take you right to our website. Some other websites that we have all about Medicare Advantage, I talked about that. It just shows more behind the scenes what's going on with the government watchdog groups and who's actually looking into it finally. American Dental Coverage, that's where you can go and find out about the dental vision hearing program that I talked about. And if you're on Medicare new and you're under 65, that would be due to disability with Social Security, 2 years on disability and you get Medicare, there's the options there explained to you. And if you're new to Medicare and you need a Part D drug plan, or if you're watching this during the annual election period where you choose a new drug plan, you can go to my website, startpartd.com. I'm Chris Westphal. Thank you so much for participating in today's video, and I hope it's been of some, there it is, of some value to you. God bless you. Thank you so much for being here. Take care. Bye-bye.